Let's talk about cervical incompetence. Well, I prefer the term cervical insufficiency because you're not incompetent. So, this is when the cervix, which is the neck of the womb, begins to shorten, soften, or open without pain or contractions. And that's usually during the second trimester, so after 12, 13 weeks. This can lead to late miscarriage or premature birth. So, what are the signs and symptoms? Because the process is often silent, many women have no obvious symptoms, but they have some subtle signs that can appear. So often women will report feeling pressure, just heaviness, a heaviness low down in the tummy with associated with pressure. And that there might also be some slight cramping or lower back ache, like a really dull ache. And there may also be some changes in your vaginal discharge. So more discharge or wetter or slight change in color or the texture. So you might find it's a little bit mucousy, a bit more sticky. Some women may also have some spotting or some sort of bloody or pinkish even, not necessarily bloody, but pinkish mucousy discharge. So who's at risk and when is it diagnosed? So it's more likely to occur in women who have had a previous late miscarriage, which is after 16 weeks. It's more likely to occur if you've had a preterm birth, which is a birth before 37 weeks. And the earlier the birth was, then the more likely the chance of it happening again. And if you've had a surgery to your cervix, such as a big LETS procedure or a cone biopsy, then this can also increase your risk. How do we diagnose it? Diagnosis is sometimes done by ultrasound scanning, which is a vaginal scan to measure the length of your cervix. And this is usually done if you've in a preterm birth clinic based on your previous history. If we find a short cervix, then we can offer you treatments. Sometimes women will come in with the symptoms that we've talked about, and we will either offer a vaginal scan if someone's able to measure the length of your cervix in the triage setting, or they will offer a speculum examination to look at the cervix from the outside, and then they can see if the cervix is starting to open. So if you have any of these symptoms, then please do reach out to your maternity unit and get some support straight away.